myself, as mentioned, I'm a vascular surgeon, so I'm a plumber for the blood flow for the body. I did my undergraduate degree in Australia and spent 12 years in the US getting my training at some of the hospitals you see over here. I then moved to SGH in 2012 and currently head the Department of Vascular Surgery and also formed the Vascular Institute at SingHealth. Outside of work, I have some hobbies. Some are more easy to do than others. I enjoy a weekend tennis session nowadays more than skiing or photography. Okay, so this is the outline of my presentation. First is to introduce the concept of varicose veins, venous reflux, and then what are some of the symptoms that you or your relatives may feel if you have it. We talk about how we diagnose the condition of chronic venous insufficiency and varicose veins, and that leads to the management and treatment options going from conservative medications, grabs, and then more invasive treatments. We explore some of the prevention strategies that may help prevent the onset of these, and what is the prognosis and outlook for these patients. We also have a patient video showcasing what a patient felt undergoing the treatment and how it's helped her. We then have a question and answer session, as I mentioned, where you can feel free to type in your questions, and then we'll close the session by 1 p.m. so that you can have your afternoon back. So varicose veins, I think we all know what they are. They are these twisted and large veins. Some of them may look like ropes or snakes or earthworms. They usually are in the legs, usually around the knee area on the inside of the thigh and below knee. Sometimes they can be associated with discoloration, darkening of the skin. We often in the past thought it was just a cosmetic condition. However, if untreated, they can progress and become more serious condition called chronic venous insufficiency. Actually, many of these have this. It's estimated that 20% of the general population, so 1 in 5 of us may have this over our lifetime. While peripheral arterial disease gets more attention, it is 10 times more prevalent. So this is something that affects a lot more people. It can affect patients of all age groups, and males and females both get affected. So it's a misconception that only females have this condition. And without treatment, this could potentially be a problem. So despite this, the vast majority remain undiagnosed and untreated. The table below shows you the prevalence by age and gender. Like all conditions, when you're young, you have less of a problem. As we get older, unfortunately, we do have many of these conditions. In females, after pregnancy, it does happen more often as well. So these are some of the statistics from US numbers. So estimate 30 million plus of the 270 million in the US have this problem, and in the world, just under 200 million have it. The costs are staggering, and like Singapore, healthcare costs are not going down anywhere. So it is important to pay attention to this condition. So this is just a pictorial representation of the people that have the condition shown in the gray figures, and the actual number who seek treatment, a small proportion in blue, and those who actually receive treatment in orange, even smaller. So the vast majority remain undiagnosed and untreated. If we compare chronic venous insufficiency as a condition affecting millions of people with the commonly known conditions, for example, heart disease, peripheral arterial disease, stroke, atrial fibrillation, you can see that actually chronic venous insufficiency is quite a big problem. It is 1.5 times more prevalent than coronary artery disease. and 10 times more prevalent than congestive heart failure. I think it's time we have more awareness of this, and I'm glad that you're joining me in this webinar so we can explore this together. I'm going to show you a video about abnormal and normal blood flow.
The deep veins run between the muscles of the legs. Contractions of these muscles, when you move your legs and ankles, help to squeeze the blood back up towards your heart. Veins also have valves that prevent the blood from flowing back towards your feet. Here we show a valve and the muscles around the vein. Varicose veins are thought to develop when the valves don't close properly. Here we show a valve in a superficial leg vein. If the valves don't work properly, the blood is able to flow backwards. Blood pools in the vein, causing the vein to stretch. This is called a varicose vein. Here we show a vein that has become varicose. Here we show a varicose vein in the lower leg. Varicose veins may cause symptoms such as aching, itchiness, or swelling of the ankles. The deep veins run.
So that was a good animation and probably clarifies what I'm trying to describe much better than I can. But this is some pictorial representation, a summary slide of what a healthy vein looks like, where the blood flow goes upwards from the foot towards the heart because this is the venous system. And in a diseased vein, the valves, they don't coalesce. So as a result, they cause reflux. And the slide on the right, the picture on the right, just showcases the action of the calf muscle. When it contracts, it helps push the blood up towards the heart, maintaining a healthy circulation. So you can see the direction of blood flow in normal, where the valves open and close, and then in the diseased vein, where the valves don't work properly. So after we talk about reflux, we then move to the middle of the slide, where over longer periods of times, they may have symptoms, and these symptoms may be aching, may be itching, may be swelling, and they may also cause varicose veins or these varicosities to develop. So this venous reflux is most common in the legs. It doesn't happen much in the arms because of gravity and because we stand, some of us, for longer than others. The visual symptoms of varicose veins are just one representation of an underlying condition. So for those that are more interested in the physiology, we know our blood pressure is 120/70. A lot of people use that figure as the gold standard. What about in the veins? So in the veins, when we are lying down, the pressure in the ankle vein is low. It's only about 10 millimeters mercury, basically the height difference between the foot and the heart. While we stand, depending on how tall you are, it's roughly 90 millimeters mercury, because again of the distance between the heart and your ankle. But when we walk, it decreases. This is the result of the calf muscle pump, and it takes place only as little as 7 steps. So this is a reminder for those of you who have been sitting for a long time, standing for a long time, to just take a walk around during this lunch break of yours. This shows in pictorial form the graph of what the venous pressure looks like when you're lying down on the left. When you're standing, it goes up to 90. And when you're walking, because of the calf muscle, it decreases. And then when you stand still again, it increases. In a defective venous system, you can see that lying down, it's still low. However, while you're walking, when the calf muscles are activated, because the valves don't work well, the pressure doesn't decrease as much as in a patient whose valves are competent. So there is a difference of this amount, roughly 40 millimeters mercury, between an abnormal venous system with defective valves and a normal patient. So standing still is the worst. How do we diagnose chronic venous insufficiency? It is not something that we can do just looking at the leg and also with a physical examination. Most of the time, we need an ultrasound scan. These ultrasound scans are non-invasive, they have no radiation, and they are relatively painless. So you can see we have the patient stand up, so it's easier for the sonographer to do this scan. At SGH, for example, we have 12 sonographers and they specialize in vascular imaging. So they create these diagrams on the right. You can see in the middle, this is a normal scan. So the straight lines represent the deep veins. There is no blood clot. On the right side, that's the LSV or GSV, great saphenous vein, on the inside of the thigh, and it showcases that the blood direction flow is correct towards the heart with no reflux. On the extreme right side, this is an abnormal venous system. This is where there is no blood clot again, but there is severe venous reflux in the great saphenous vein. The size of the vein has also increased from what we call normal, around 3 millimeters or so, to as much as 15 millimeters. So it's 5 times as large. So this patient, other than the varicose veins that we can see, also has severe venous reflux for likely an extended period of time. So this is what an ultrasound looks like. What are the risk factors? As mentioned, age. As we get older, we have higher risk for venous insufficiency, likely due to more prolonged cumulative standing. Family history also possible. A lot of our mothers and aunts have this. Lack of exercise, previous leg injury. If you carry excessive weight around your belly region, it leads to the blood not being able to go back. Multiple pregnancies could cause this as well, and deep venous thrombosis or blood clots often cause the valves to be defective. These are some of the symptoms and signs. Varicose veins are what we can see on the external surface. We also can have swelling. Often patients complain of leg heaviness and fatigue, especially after a long day. They feel like they really need to put their legs up. They don't complain as much of pain, but this ache and this feeling of heaviness. Sometimes they also have itching of the skin, skin changes, restless legs. What we want to prevent is the last one, which is open wounds or ulcers. That is definitely not what we like to see, and we like to catch it beforehand. These are some of the stages of venous disease, from C1, the most mild, to C6, the venous ulcer. I'll go through them one at a time in the next few slides. This is a classification system that is well adopted by the vascular surgeons who treat this kind of disease. So this, I quote from this Born Vein study, a German study, many years ago now, but the prevalence and the incidence of these don't really change much. So most patients complain of these spider veins or telangiectasias. They look not so nice, and it's largely a cosmetic condition. Next, we have those varicose veins that we already described, and they are large and rope-like. They can occur most likely on the inside surface of the lower leg or behind the knee, sometimes also in the thigh. Next, for C3 disease, we can have some leg swelling. You can see if you push down on your leg, especially on the inside of the lower leg, you create a dent that takes a while to get better. At the ankle, oftentimes you can see the difference between the left and the right leg, as shown over here. Also, skin changes that can happen. You can see around the ankle region. This patient also has a wound, but you can see this pattern of venous congestion around the ankle. Skin changes can also include hyperpigmentation and may also lead to cellulitis or dermatitis, which require treatment of the infection, and then subsequently we treat the veins. After an ulcer heals, you can get a scar, as shown over here, C5 disease. This is a healed venous ulcer. most of the time is around the inside, around the ankle of the leg. This is an active venous ulcer. This is where the red cells are pushed out, they have senescence or they die, and the pigment creates an irritation. You can see this is an angry looking wound. Fortunately, they are not very common. So I hope those pictures didn't really bother your lunch too much. Next, we talk about the treatment options. One is conservative. We talk about exercise, modifying your lifestyle, trying to put your legs up as much as possible. And then there are compressive therapies, which can include compression socks or wraps or stockings. And then they can be elastic bandages as well. I'll go through some of this. If you have a venous ulcer, you might be asked to have a 4-layer bandage. This is to create about 30 to 40 millimeters compression around your legs. For those who remember, when you stand, the difference between standing and walking and activation the calf compression pumps is about 40 millimeters mercury. That's why we give 40 millimeter compression in a 4-layer bandage. However, in hot and humid Singapore, you can imagine that most patients will not be happy with this form of therapy, as you can see over here. So it's not very popular, however, sometimes needed to help the ulcer heal. Compression stockings or compression socks can be an alternative. I know that most of us cannot read what's on the right. This is a German, I think, slide. And it goes through the different kinds that are available in the different colors of blue, orange, green, yellow, red. So different kinds of compression. This is just one of them that you can find online in our pharmacy and in multiple different locations in Singapore. So the aim, first of all, would be to make sure they are correctly sized. So ideally, you measure your leg yourself or somebody measures it for you. Our pharmacy has a service where we measure it for you. That way, you can get the correct type and the correct size of sock for your disease pattern. So you can see that depending on the disease, you can get lower pressures at about 15 millimeters mercury or class 1 versus higher up to class 3 or 4 if you have venous ulcer or lymphedema. So in terms of the ulceration, now what is the evidence for this recommendation? So the European Society of Vascular Surgery, or ESVS, recommends compression therapy to improve ulcer healing. As mentioned already, this 4-layer wrap is not very popular, but it is what is required to heal the ulcer. The other possibility can be those bandages or one of those sleeves that you can see in the lower right, so that you can have a high pressure, and these are pretty tight, 40 millimeters mercury, to improve the ulcer healing time as well as the chance of success. This is really quite important. This, of course, requires compliance on our patient's part, and this is why the physicians will partner with you on your journey should this be needed. What kind of compression stockings? So you can see there can be those support pantyhoses, there can be the TED stockings that you get from the hospital. These are very light pressure. Then there are the heavier ones with compression, where it's class 1 to class 4 that I described. And as mentioned, you can find them online in drugstores, pharmacies, in hospitals. And then the prescription medical grade ones, we want to make sure they're adequately fitted to make sure that they are going to be effective, but not so tight they can affect your circulation. This is an older slide, and I'm not sure what the prices are today, but this is a representation. The longer it is, the more expensive it is, the more difficult it is for you to put on. So we note that compliance may be an issue, especially in our older patients where they may have a little arthritis in their fingers and it's difficult to put on the stockings. At night, these stockings are not required. If you like to wear it, you can. However, at night, because as mentioned, if you are lying down, the venous pressure is low, so wearing compression is not very essential at night, unless you have a venous ulcer. That will be a different issue. This is an example of an aid to help wear these compression. Wearing compression is not easy. I have tried myself, and definitely across the ankle joint and across the knee joint, it does take some manual dexterity to help wear them. Some of my patients tell me it takes upwards of half an hour to wear one. So you can imagine how frustrating it is to get them on and off, especially when this is a daily problem. This is just an example of one aid that can help wear these. Next, we then move on to medical therapy. So I'm going to describe some of these that you see in the orange box. For example, Deflon. This is probably the most commonly prescribed. It is like a vitamin. It can be available online. I took a picture of this Watson's page. I don't think the price is the same as what I took it as before, but you can get it. And it's like a vitamin. Sometimes it helps, sometimes it doesn't have any significant benefit, but usually has no significant side effect. I wanted to show you some kind of evidence for the use of Deflon. This is from the Cochrane database. It's a high-level evidence based out of systemic reviews, and it looks at this Deflon combination. So for some of these, for example, swelling, pain, cramps, heaviness, there are some that if the RR is less than 1, you have some benefit. But in others, for example, pain and heaviness, there is no benefit based on randomized controlled trials, which are the best level of evidence in medicine. In venous ulcer healing, there is no benefit to Deflon, so your physician will likely prescribe something else called pentoxifylline for venous ulcers. I just wanted to get this Deflon out of the way because it's the most commonly prescribed and taken medication for venous disease. Next, we talk about more invasive options now. And this endovenous thermal ablation is a minimally invasive form, either radiofrequency or laser. This is an example of an energy device on the right side. In this case, it's radiofrequency, but laser works the same way. So you're going to use heat to ablate or damage the vein to form scar tissue so that the vein closes. That way there is no more reflux. As mentioned, this is minimally invasive and uses local tumescent anesthesia, so the patient can be awake for this. So it's either laser or radiofrequency energy converted to heat to damage the vein so that scar will form and the varicose vein will close. Then I talk a little bit next about historical treatment options, sometimes also done today, which is called high ligation division and stripping. We don't do it as often anymore because it requires general anesthesia. It's quite painful. It causes quite a lot of bruising and usually requires a hospitalization. So this is where you can see the picture. On the right side, what equipment is required. And then on the bottom left is the varicose vein or the great saphenous vein being stripped. This is a vein that is got reflux, which I showed you on the duplex ultrasound examination, where the blood flow is not in the correct direction, and the vein is physically removed through the use of this stripper on the upper right side. You can see the stripper being introduced into the vein. So this has been done for a long time, many decades. However, it is quite painful, and today very few patients undergo this procedure with the minimally invasive options that I described just now, as well as what I described next. Next will be the non-thermal, non-tumescent forms of ablation. So you can see sclerotherapy, mechanical, chemical, as well as cyanoacrylate that I'll spend some time on. I'll show you a injection of a video of injection sclerotherapy, something that you may find on YouTube channels. These are for C1 disease, as I mentioned, for spider veins, which are largely cosmetic. This is a small needle identifying the vein and injecting a sclerosant inside, which displaces the blood in the vein and looks like magic. This video obviously showcases a successful ablation. What it doesn't show is that the vein will and may get red for up to about 6 weeks, after which it will slowly fade away, but it may require repeat injections. So it's not what we do all that commonly because of the cosmetic nature of these. Next will be on the minimally invasive, non-thermal, non-tumescent closure system called VenaSeal, otherwise medically cyanoacrylate closure system. It's like the super glue, and it's gluing the vein at 3 centimeter intervals so that the vein no longer has reflux. At SGH, we have done about 3,000 plus cases, and since 2016, patients have been undergoing this procedure with good feedback. Earlier on, the Straits Times had this publication showcasing what was done and how this is a new technology. And fortunately, we've had many patients that already have good outcomes from this procedure. So this is just describing some of the details where the catheter is inserted under ultrasound, local anesthesia, pressure is applied, and the vein collapses after the VenaSeal glue is polymerized. And then a bandage is applied on the wound, and the patient gets to go home the same day. The results are quite good so far. The closure rates at 5 years in the trial is just under 95%, with improvement in the symptoms, otherwise shown over here, 75% improvement in VCSS scores, and many patients would undergo this procedure again. So from the patient standpoint, it's local anesthesia day surgery. We like to keep patients out of hospital. As we all know, hospital beds are under high pressure these days, and patients don't like to stay in hospital where possible. The advantage for this is do not need compression stockings, which we need for 2 weeks usually for laser and radiofrequency ablation. And this is one of the newest technologies, and Singaporeans like everything new. So they like this procedure. Some of the patient's legs of those undergone procedure, and it looks generally quite good. You can treat also below the knee, in this case, a patient on the left-hand side with the discoloration all the way up to the ankle region. These are some pictures. If you have varicose veins and you don't remove them, which is also possible, the veins do not disappear. However, they are going to be less visible because they're not so pressurized after the venous reflux is taken care of. However, many patients opt to have multiple stab avulsions. This is where we create small incisions about a few millimeters to remove the veins. That way the vein is physically removed. I'm going to next end by showing you a patient video of what they feel.
It was just a constant reminder of that something was wrong, and it was very frustrating because I wasn't sure what was going on. Yeah, so my name is Filippa. I'm 30 years old. I have lived in Singapore since 2014. I love being outdoors, exercise, running in particular. I used to go for hikes. That's basically how I spend my free time. I think about 2 years ago, I realized that something was wrong with my leg and I wasn't sure what it was. So the leg was swollen, it was aching a lot, and I had these pins and needles quite often. And close to my ankle, it was almost like a spider web, so it was hard to walk. Yeah, just very uncomfortable, like always. So it stopped me from running, and instead I started to walk, but it didn't go away despite that. But I couldn't run, and most of the exercise that I love doing I had to stop doing that. I did seek treatment quite a few times, both in Sweden and in Singapore, but the doctors told me that it was probably water retention. It was actually it was unbearable after a while because it prevented me from living the lifestyle I was used to, and I was worried it was something bigger than just water retention. I went to see a doctor who did an ultrasound, and he then referred me to Professor Chong. And then I had a day surgery. All went very smooth. And now I can run again. I'm outdoors more often. I don't have to worry about what I wear. And again, like the pressure on my leg and on my foot especially, it's just gone. So it feels like I can, move like properly again. I'm very grateful for that we could identify that this was a chronic venous insufficiency. Well, I am doing the things that I used to do, which I haven't been doing for 2 years. So I'm running a lot. I'm out going for hikes and spending most of my time outdoors.
So that was Philippa. She had a good result and she's very happy with her treatment. And many patients often also mention that the heaviness is gone, which is definitely what we like them to improve on.
It was just.
So my department, we're fortunate to have 8 of us, and all of them do these procedures and can contribute to the improvement of your venous varicose vein health should you need us. Okay, I'll stop here. Thank you very much for your attention. We'll move on to the next segment, which is on the question and answer. Please feel free to type your questions in, and I'll try to answer them. Okay, I'll go through them one at a time. First question is on leg cramps. Are they caused by varicose veins? So leg cramps are one of those conditions that are very common. It may or may not be caused by varicose veins. Varicose veins or chronic venous insufficiency could be a cause of leg cramps. So oftentimes we try to ascertain, when does it happen? Does it occur when you're sleeping, when you're walking, when you're standing? Because if it happens when you are asleep, it is less likely that it could be due to venous reflux, because venous reflux happens mostly when you are standing upright. So if it's when you're sleeping, which many patients describe this, then it is less likely due to varicose veins or venous reflux. It's a good question. Next question is, what is the optimal standing duration for a normal person per day? I don't think we have such a recommendation. I think like everything else, we want to do things in moderation. Standing without movement is actually not good for venous health. So imagine the guard at Istana. That is actually quite challenging for the venous system because you're not moving, you're not activating the calf muscle pump. However, if you are standing, walking, moving about, then I think that is not so bad. So regular exercise is a good idea for general health. It's also good for the veins. There is no optimal standing duration. The next question is regarding the CEAP classification, C1 to C6 that I described. C1 is mild and C6 is most severe. CEAP is just an acronym for each one of them, and I don't think we need to go through this. But C1 is the most mild. C0 means you have no venous disease at all. And C1, like I mentioned, is the spider vein, the telangiectasia, which is basically kind of normal. It doesn't cause many symptoms, and it may be cosmetically displeasing. C6, if you remember, would be those active venous ulcers we talked about. The next question is, for leg elevation, it is sufficient to just place a bolster below both legs while sleeping at night? What is the best position? So first of all, I think that based on the venous physiology, sleeping, lying recumbent is actually very good for the veins because the venous pressure is already low. Should you want to improve that further, raising your legs using pillows could be an alternative. However, it can be quite uncomfortable if you try to sleep with your legs raised. So I think that if you just lie flat alone is good. If you want to raise it, then sure, pillows would be good to raise your legs so that we decrease venous pressure even further. There is no recommendation of where to put your pillows. You can put it below your calves, below your ankles, whatever you prefer. The next question is regarding if a patient has varicose veins, at what point should the person seek medical help? That's a good question. A lot of times, my patients are brought in by their concerned family member or sometimes even by their grandchildren because they've had varicose veins for a long time. These varicose veins, if they develop venous ulcers, discoloration cause heaviness, aches, swelling, skin itchiness, all of this should be a trigger for medical attention so that we can try to find the cause of the problem and try to improve it. If you have no symptoms whatsoever from it, then it's not an urgency to go seek medical treatment because you don't have any symptoms for it. I think I will go by the symptoms and then the signs, which are the varicose veins, the discoloration, presence of ulcers, all of this, to decide whether or not varicose vein intervention, treatment, or consultation is required. Next question from Serene would be how to prevent varicose veins. It's a good question. We talked about the risk factors for varicose veins. So increasing age, females get it more than males. Patients who stand for a long time get it, family history, blood clots, etc. So a lot of these we cannot change. What we can do would be to minimize standing time. But again, different occupations, for example, sales personnel, teachers, airline staff, medical workers need to stand for long periods of time. So you really can't change your occupation that much as well. You can try to minimize these standing times, but if you can't, what you can consider doing is to wear compression stockings. Many of my healthcare worker colleagues wear compression stockings and you can't tell because they wear underneath their uniforms, for example. So this could be a consideration. And you only need class 1, which is the lighter form, 10 to 15 millimeters mercury, in order to make it more comfortable for you. Next question is how to prevent varicose veins. Is it hereditary? I think we have almost answered this in the previous question. To prevent varicose veins, you have no pressure in your venous system, and the best position is like a bed where you hang upside down. I think most of us cannot be in that position most of the time. So I think that with the compression stockings and minimizing long periods of standing would be ideal. As mentioned, there is a hereditary component. So if your mother or aunts have this, you are more likely to have this. The next question, is it necessary to get compression socks to cover the whole foot or only until the ankle area? So compression stockings or compression socks can be open toe or closed toe. I don't think there's a significant difference. If you do have foot swelling, then you want to consider a closed toe one. But otherwise, I don't think it's that crucial or any difference. So thanks, Sylvia, for the question. Next question, varicocelectomy procedure about 40 years ago. Does the procedure affect varicose veins in the long term? So hopefully that procedure would have helped you and decreased the symptoms that you might have had at that time. If the symptoms have gone away, that's a good thing. It doesn't affect those varicose veins. As mentioned, varicose veins have reflux and the blood flow or the blood return is already compromised. So those veins are not really helping your venous system, and removing it is fine. So it doesn't really affect the normal functioning of the veins. The blood returns to the heart via the other normal veins in the legs in these kind of cases. Thanks for the question. Next question relates to exercise. What kind of exercise would be good for varicose veins? I don't think there's a specific exercise for varicose veins. Exercise in general is good for health, and I don't think there is anything that is specific to varicose veins. As mentioned, long periods of standing is not good, but I don't think there's any exercise that has long periods of standing. If you activate your calf muscle pumps, it is good for the varicose veins already. So no specific form of exercise for varicose veins. Next question is about big green veins on the hands. Are they varicose veins? So as mentioned, varicose veins or venous reflux mainly affect the lower extremity or the legs. The hands, all of us have visible veins in our hands. This is part of the normal venous system. If you're fair skinned or if you're slim, there's not a lot of fat around your fingers, you can see those veins more clearly. Those are normal veins. They do not need treatment. Very, very rarely do veins in the hands cause symptoms that require treatment. So I would say these are mostly normal veins. Next question describes a 52-year-old female, no varicose veins. Is it necessary to wear compression socks for prevention? I think if you have no symptoms, there is no need to do that. Most of the time, you may not develop varicose veins. People who exercise a lot now wear a lot of compression. So if you will fit into that category and you think it helps improve your exercise performance, by all means, go ahead. But I would say that for prevention, maybe not necessary. If you are in an occupation where you stand a lot, you might want to consider doing that. But otherwise, for general public, I don't think it's necessary. Okay, it's great that you have so many questions. Keep those coming. I'll try to get to most of them. Next is Sherry Tay talks about having spider veins in both calves and thighs. Will wearing pressure stockings daily reduce this? So pressure stockings would be good to support the venous system and likely prevent more of them from popping out. However, for those who already have that, you will unlikely make it disappear. When you wear the compression, they will be less pressurized. As a result, they will not be as bulgy and will not be as big. So that may help. Also, it may help the symptoms if there are any, like swelling, like itchiness, like heaviness. So compression could help there. Otherwise, spider veins in general are cosmetic, and while they can be injected like I showed you in the video, they are not medically necessary. Next, does removal of veins affect the body's blood circulation since one will have less veins? It's a good question, and it is intuitive. If you get rid of veins, will there be a problem? Definitely, if you get rid of all veins in the legs, you will have a problem. You have a very swollen leg. However, we're only getting rid of those veins that have venous reflux that are not contributing to the proper functioning of venous return for the legs. Therefore, it is not going to affect it. During the scan, we take a look at the deep veins as well to see whether or not there are deep venous reflux. If there is deep venous reflux or if there are blood clots, sometimes we would refrain from doing anything to the superficial venous system, which is the target for venous ablation or the treatments that I've described. So I think we have got to take the total venous circulation in whole in order to decide on any treatment option. Next question. Does regular foot massage help alleviate these vein issues? I know that many people like massages, including foot massages, and it definitely helps with your muscles, the soreness, and for those who stand a lot, it doesn't really harm, hurt, or improve the venous system. I think it's a form of self-care that many people like to indulge in, and it's certainly okay from the varicose vein standpoint, but I'm not sure if it would improve the vein issues for this. Next question, does jogging make it worse for varicose veins? As mentioned, no exercise is generally is good. If you're jogging, it's good for your health, it's good for your cardiovascular system, um, and your calf muscles are activated when you jog. So no, it is not bad for varicose veins. So carry on the good work with the exercise. Next question, does the patient get numbness in the legs after the non-invasive surgery? If yes, does the numbness go away after a short period? It's a good question. So the vein is close to sometimes the nerve. And if the nerve is somehow affected because of heat therapy or whatnot, there can be some numbness thing that can happen. So it really depends on if the nerve is affected. And if it's not affected, it may be a transient phenomenon where it gets better after a few weeks. Next question is about spider veins. What treatment would you recommend for spider veins with no other symptoms such as pain or heaviness? I think for spider veins, it is largely a cosmetic issue, and if you have no symptoms, they can be left alone. I know that we are very conscious of our looks, especially those who like to wear maybe shorts or shorter skirts, and this could be a concern. However, medically, it should not be an issue. Uh, Next, Sylvia has a question about for people over 70 years, is it necessary to remove CVI? If not doing it, what will happen in future, any life-threatening case? So chronic venous insufficiency over time can develop into, for example, C6 disease or active venous ulcers. That's definitely not what we like to see. And if that happens, then we need to treat it. If the patient has symptoms, regardless of age, we can consider treatment. So I don't think age is a barrier for treatment. And the treatment mentioned can be day surgery and minimally invasive. So oftentimes, age is not a sole consideration. I think most of the time we have to decide if the symptoms are related, if there is really chronic venous insufficiency, and if treatment would help improve the health of the patient, the symptoms of the patient. So not really just age. Next question from Lily is, what are the side effects of VenaSeal? I think it's a good question. VenaSeal is a minimally invasive therapy. Minimally invasive is not non-invasive. So any invasive treatment can have potential for side effects, and this could be recurrence. After 5 to 10 years, you could have recurrence. Any therapy would have a failure rate. You could also have what is called phlebitis or inflammation of the veins due to the interaction of the glue and the vein. These oftentimes treated with medication, and sometimes patients can have side effects of a little bit of bleeding or bruising from this as well. So for extensive discussion, I think you want to discuss this with your healthcare provider. Next is what are the best exercises to prevent these issues for seniors? So as mentioned already, there's no specific exercise for varicose veins, but exercise in general is good, so please continue doing that. Elaine Tan mentioned, how do I prepare myself for a flight if I have varicose veins? So there's no specific preparation for people with varicose veins versus people that don't have. For flights, especially long flights, it is often recommended for some movement within the cabin, so walking around a little bit, minimize dehydration. So for those who tend to consume a lot of alcohol, may not be the best for the veins. Some people wear compression stockings during the flights to minimize the swelling. That can be considered. So these are some of the strategies: hydration, movement, and compression. Next question, how often do we need to do leg scanning? So I mentioned the duplex ultrasound would be the diagnostic test for this condition. The vein condition usually don't change in years. So if you've had one recently, you do not need a yearly surveillance scan, for example. This is definitely not required. Sue mentioned something that occurs in the upper thigh. This is something that we could look at if there's venous reflux and the varicose vein occurs from the venous reflux. Certainly, it could be something that we can address. CC's question is, how do we know if we need to seek medical help if the veins are showing up on the legs, but otherwise there is no pain or discomfort? I think like everything, we want to make sure that there is some symptoms before we address so that it is a medical issue that can be improved with treatment. Clara has a question about Hirudoid cream to help mild spider veins. I know that there are different marketing creams that claim effects. If it does help you, please go ahead. It usually doesn't have any significant side effects. Hirudoid creams may be better to help quicken bruises to get better, but I'm not sure if spider veins will be much improved with Hirudoid cream because they are a physical structure in the leg. They are small veins basically, so it is difficult to imagine that any cream can make it disappear. Ita has a question on what can be done to prevent having varicose veins. I think we've gone through this, minimize long-standing. James has a question about the time duration between C1 and C2 and beyond. So that's a good question. These venous diseases don't often and always follow the progression from C1, C2, C3, C4, C5, C6. So it's not like there's any time interval that will be typical. Many times patients have C1 for the rest of their lives. So I would not be able to give you a time duration. There is no such guideline. Next question is about varicose veins and its association with restless legs. It is possible. I would say that if it's really bothersome, you might want to consider getting some physician input. Prevalence of CVI in Singapore is the next question, and I think it mirrors the US in terms of percentage prevalence, probably in the 10% or so range. Next question is on which stocking is the best to use and how long to wear. As I mentioned, this would be ideal for long-standing. There is no best stocking. If there were a best, the others wouldn't exist. So as long as they fit you, it's important you get the right fit for the right size and then the right compression grade. Next question is on if your job requires long-standing, what is the best method to reduce this pressure? I think compression stockings would be a good start. When you take breaks, try to elevate your legs if possible, activate the calf muscle pumps. So hyperpigmentation is the next question with no swelling or obvious spider veins. So hyperpigmentation is very common on the medial side, on the inside around the ankle. It is unfortunately quite common. We cannot reverse this. Once the skin changes color, we can try whitening creams, and the whitening creams are quite similar to those commercial face whitening creams. And depending on your condition, it may or may not be very effective. So I think that for these conditions, you can consider looking at some kind of consultation if you have symptoms. If it's just discoloration, I think you can leave it alone as well. Next question from Doris about magnesium tablets. I'm sorry, I'm not aware that magnesium supplements help this condition. Next question from Jaya talks about spider veins. What kind of treatments with no symptoms? And yes, as mentioned, these tend to be a more cosmetic condition. Injection sclerotherapy, like I shown, could be one treatment options. Depends on the size and the depth. It could be laser therapy as well. These are something you might want to discuss with your doctor about, but it may be cosmetic. Next question from Jolene. Do all spider veins lead to CVI? No, they don't. Most of the time they're isolated, so don't worry about it. Clem has a question on jogging. I think we already talked about that. Emily has a question on spider veins. I think we also discussed this as well. Sue's question on upper thigh veins. We also talked about this already. The next question is on after the super glue procedure, will varicose veins return? How long is the recovery period? I think we also discussed that this is a day surgery procedure. You're able to walk on the same day. Heavy exercise, I usually recommend 2-week abstinence. I'm talking about those that like their HIIT or go for a long run, that kind of stuff. But regular walking for the groceries, for food, that should be okay. The recurrence rate at 10 years is estimated at 5 to 10% for the venous ablation. We've started this since 2016 and we have had some recurrences, but they are very minimal. So in general, it's quite good. Okay, I think we'll come to the end of this. I appreciate that there are many, many more questions. I'm sorry I can't get through all of the questions. Thank you very much for joining me in today's webinar. Appreciate you taking the time to learn about varicose veins and venous reflux. I hope this session has helped you. Have a good afternoon.